Hello, I'm Angelle from the Cath Lab.
And I'm Jennifer from the Cath Lab. We'll be talking about hip injections, HSGs, and tenexfasciotomies for Dr. Harlin's procedures.
And if you don't know, a HSG is a hysterosalpingogram.
I can't say it, but
where he injects dye into the patient's fallopian tubes to see if they have any blockages. This is done for women that are having fertility problems.
And this is the order sheet for those 3 procedures that you'll see in pre-op when you go to check that patient in.
Yes, and although they're 3 different procedures, he uses the same orders for all 3. So we'll start with the hip injection.
Yes. No IV, no labs, and then they go to PACU after. That's for the hip injections.
He doesn't use anesthesia for his hip injections. I know some of the pain doctors do. He doesn't. He just injects that hip and we send him on. For the hysterosalpingogram or the HSG, that's going to be done in one of the OR rooms. The patient does have to be placed up in stirrups. Make sure the patient has a negative UPT beforehand, of course. It'd be great if they didn't, because that's what they're trying to do. And then the other thing to note with these is he does not use an IV, does not drop any labs. He also does not give them any medication, and it's very painful during the procedure. He feels like it's too quick to use sedation, so that's why he doesn't use it. He does go through the patient's cervix to inject the dye into the fallopian tubes. So a lot of times the best thing I can do is hold my patient's hand and grit my teeth with her.
While she cries.
Some of the patients do cry. It's painful when he injects the contrast, and until it absorbs some, they cramp pretty good. So the patients will cramp for about 5 or 10 minutes afterwards. And I always let the patients notice ahead of time, and he does too. He lets them know.
Okay, the tenexfasciotomy. Anybody with plantar fasciitis knows how painful it is, but this procedure actually goes in and breaks up any scar tissue that's been forming from plantar fasciitis. No IV, no lab work. It will be done on the stretcher. The tenex rep will always be present to assist the doctor through the procedure because he's got fluids that he needs to hang and hands him the tools that he needs. If the procedure is performed on the ankle, the patient will need a special boot, and that normally comes through the OR, that special boot that the patient needs to be placed in before leaving the facility.
Sometimes they bring their own boot, so they can use their own boot if they already have one. If they don't, then we'll give them one. This procedure can also be done on knees. When he does them on the knees, he doesn't brace them or anything afterwards. They can just get up and walk and go home. Yes.